to speak. Are you wanting to combine your time?
Actually, Chair, I'm going to speak for 5 minutes, and then I'll ask the Minister to respond.
To everything.
Thank you.
Yeah.
Go ahead.
Well, thank you, Chair. My final section here, I'm going to focus mostly on communications that I've had in recent months with the Pharmacy Association and the concerns. And how this relates to budget, of course, is that this is one of the most highly touted areas where the government has claimed that it is saving taxpayer dollars. And while there is a saving on first blush, there's no question that in the long run this will cost Albertans much more than it will actually save. The consultations that were undertaken with the Pharmacy Association were undertaken not in a spirit of cooperation, but in a spirit of largely a focus largely only on cost containment. And while I can understand the need for cost containment, I know the pharmacists were extremely bothered by having to sign a non-disclosure agreement. Now, the Minister has indicated that this is standard procedure, and yet when the Medical Association is negotiating with Alberta Health, I receive nearly weekly updates from the President of the Alberta Medical Association indicating what the latest progress on those talks are. The pharmacists were not allowed to communicate to their profession in the same way, and as a result, a number of the things that ended up in the final agreement, once the pharmacists actually learned of what had been agreed to with, I will point out, a third-party hired negotiator, were extremely distressing to pharmacists. Pharmacists, I'd like to stress, are frontline healthcare workers. Now, they don't belong to a union, and they are private business people in large measure, but they are frontline healthcare workers. And the pharmacy network and the pharmacy funding framework that we have in the province of Alberta is a leader amongst all provinces. And it was developed after extensive consultation directly with one of your predecessors, Minister, through Minister Horn and the Pharmacy Association after the consequences of the lowering in prices of generic drugs was brought forward in 2012 and 2013. Alberta pharmacists led the charge in terms of expanding their scope of practice and allowing them to work to a greater extent directly with patients, as pharmacists are the most accessible health care professional in the community. And 95% of Albertans identify pharmacists as being the most accessible health care professional in the community, and in many communities, pharmacists have been there for many generations and have stayed longer where there has been a much greater turnover of other healthcare professionals. Another area that is changed by this new framework is the Advanced Prescribing Authority. This was one of the innovations that was brought in recently, and pharmacists across Alberta, about 1/3, would take the additional time and incur the extra expense of obtaining Advanced Prescribing Authority, and for that, they were compensated at a differential rate. The new framework eliminates that differential. And so my question to the Minister, amongst others, is why, as a pharmacist, would you go to the extra time and expense of achieving Advanced Prescribing Authority when now there's no difference in what you charge for it? Alberta and its leadership position, as far as I'm concerned, is being absolutely questioned by this new agreement. One of the most distressing areas is the whole area of risk sharing, which was a bargaining chip that the Pharmacy Association placed on the table and was eagerly gobbled up by the government's negotiator, and in return they gave nothing as far as the up to 40 recommendations that pharmacists made for cutting of costs. I've already highlighted with the Minister in question period, and I noticed she just mentioned it with regards to the services to vulnerable populations and programs like ACE. ACE, Minister, has an estimated annual cost of approximately $500,000, and their estimates is that it saves the healthcare system some $3 million. Now, I'm really glad to hear that you're planning on meeting with them again, because as recently a week ago, the last communication I had with them is that there were no ongoing discussions between ACE and the government, and the discussions that were held were only concerned about the cost of the ACE team. The Pan-Canadian framework has also resulted in an unintended consequence of a lack of ability of generic drugs, for example, metformin, one of the most common diabetes type 2 oral hypoglycemic agent. And as a result of that, pharmacists are now having to dispense the brand name drug at many times a higher cost, and those additional costs are being borne by the taxpayer. Minister, and I want to make it clear, and I want to be on the public record, that I support our pharmacy profession. Our pharmacists are professionals, and they are concerned with the health care of their patients, and they do it because they care about their patients, and that this latest funding agreement is an affront to the pharmacy profession, and I urge the minister to reopen the negotiations directly with the pharmacy profession.
Thank you. Go ahead, Minister.
Thank you. I want to also state on the record that I absolutely respect the pharmacy profession and the individuals who provide service in this regard, including pharmacists and their technicians and other staff in this area. And this is one of the reasons why, even though it was completely within our jurisdiction to impose a fee schedule and to impose a rate of compensation, we decided instead to sit down at the table. This is not standard practice across Canada. So what we did is we sat down with our budget, which is a 4.3% increase, and we said we know that the increase that was negotiated under previous government would probably see a 12% increase. We know that that's not fair or sustainable, and we want to work with you to come up with a model that does in fact land in a place that 12% increase wouldn't happen, but the 4.3 would, and that it would be focused on patients and patient outcomes. So for members to regularly speak in the House about cost restraint, this is exactly the way that we achieve restraint without impacting patients, and we are happy of the fact that when we sat down at the table with our proposal, many amendments were made to it, which means that many of the components, for example, as was mentioned, the holdback piece was something that they said to say, here's the insurance that we're going to live within the parameters that we agreed to, and if we don't, then there's the holdback. But if we do reach the agreement and the parameters that we've set, then this won't be required. I want to say that that's an important piece to note, that when we sat down, they said it's really important to us that the dispensing fees stay as high as possible. So there was only a 15-cent reduction to dispensing fees, and instead there was movement on some of the other items, like immunizations for flu. So I also want to clarify that there wasn't a third-party negotiator. It was an ADM from the Ministry of Health who did the negotiating on behalf of the people of Alberta, and so I really do need to set the record straight on that. In terms of the NDA, there was within the NDA a provision to allow the RXA to not only disclose information regarding the consultation to its board, the association's professional advisors and consultants, but also to allow RXA to exchange any other persons that they felt it was necessary for them to share information being discussed in the consultation subject to a confidentiality agreement that was put in place. So as with the AMA, regularly they will say, we think it's important for us to tell our members that there are some pieces that we're discussing that I don't want to keep from them. We're planning on sending out a president's letter, and these are some of the key things that we're going to talk about from the discussion. These are the kinds of consultations that typically take place, and I understand that there has been some pushback, but I want to say that I am incredibly proud of the process that we undertook. Instead of imposing something on these professionals, we asked their professional association, the RXA, to join us at the table and come up with something that was sustainable. A 4.3% increase, I think, is something far greater than any of the opposition members would be proposing, given their proposals for billions of dollars of cuts. We're investing increases in this area, and we did it in a way that is going to reach far greater sustainability. So government is responsible and needs to take careful control of pharmacy costs while making sure that high-quality services are still available to Albertans. All health professionals, doctors, nurses, dentists have a role to play in terms of sustainability of the public healthcare system. And I understand that there were many agreements made under previous governments that saw escalators in excess of 10%. Part of me can't help but wonder if the intent was to put these pressures in place so public health care would not be successful in the long term. And certainly I hope that that isn't the outcome, but my responsibility is to ensure sustainability, ensure a public system that can be here for future generations. So having a 4.3% growth item that's focused on the people of this province as the primary charger and doing it in a way that reached an agreement at the end of the day with the RXA rather than imposing one that is done across the country, I think shows that we honor the professionalism of the experts in this area. With these changes, Alberta still compensates pharmacists more than the national average by far, and when it comes to dispensing fees, clinical services, and administration of publicly funded vaccines, higher than most other jurisdictions within our country. And Alberta will see out-of-pocket savings for individuals. For example, 8,700 seniors will save more than $100 a year. In some cases, individuals will save more than $500 a year because we put caps on the number of times that people can be required to come in to see the individual for certain prescriptions, for example. I think the individual member may have been one of the MLAs who's brought up that sometimes in assisted living facilities there was requirements that prescriptions get filled daily or weekly rather than being able to have a prescription you've been on for years filled in a more in a larger volume.
Thank you. I'd like to invite Mr. Shepherd